Thank you so much, Doctor. That was a very, very powerful presentation.
You're welcome. I'm going to drink my smoothie. Look, it's not a prop. I got it here.
All right. So I'm sure it's delicious. So
yeah, and look, gallon of water. I practice what I preach.
That's great. That's great. You definitely have a high energy to you for sure. So we're going to begin our Q&A. We'll be asking questions of the doctor and also give the audience the ability to ask questions as well. We just first want to explain to everybody how this works. We don't take questions directly from the chat. Instead, we ask everyone to raise their hands virtually. If you're not sure how to do this, to the bottom right, second from the right, there's a button called reactions. You're going to click on that. And from the pop-up menu, you're going to click on the raise hand function. We will then take questions in the order in which they were received. When it's your turn, I will unmute you and ask you to state where you're from and ask your question. We ask that everyone keeps their questions brief and on topic, and then I will mute you. In order to keep things moving, we ask that you just ask one question at a time. If you do want to ask a second question and there is time, please raise your hand again. And if we can get to you, we will get to that question as well. So real quickly, I will open it up to the audience and we'll start off with Sophia. Sophia, please state where you're from and ask your question to the doctor.
Yes, thank you. Hi, doctor. My name is Sophia from Ottawa, Canada. Yes, please. I have knee synovial inflammation, bakery cyst, and toffee in my knee. My question is, would it be possible to get rid of toffee without medication?
Toffee? I'm not sure I understand.
Like bumps around my knee, because I put on knee braces. Maybe these are crystals, maybe... and it's like bumps that get around all my knees.
Bumps? Is it bumps? I'm sorry, I'm just having a little bit of trouble.
She is saying bumps. I'm not sure. It sounded like the coffee thing. I'm not sure what she's saying. Can you spell that, Sophia, if you know how to spell?
Toffee is T-O-P-H-I. It's like crystal due to gout, maybe.
Okay.
But I don't have really gout in my...
okay, but it's uric acid. Uric acid.
Yeah.
Okay.
Yeah.
I'm sorry. I'm so sorry. I was just having a little trouble.
No problem.
So, my protocol is specific for, again, cellular repair, not for disease. So if the only time I will say a definite yes to anything is if I have a case that says, yes, here's someone who had exactly that, and here's what happened. And I can't think of a person right now that had those uric acid deposits, but I can say that it's been helpful for people with all different types of arthritis, and it has helped people with gout. So I don't see any reason why it couldn't be helpful. I know for sure it'll be good for your health. So we can see what happens with those deposits, and please let me know. But in the meantime, your immune system will get healthier, your inflammation will come down. So there's no downside. You know what I mean? But I don't know if the deposits will go away, but I do know that your inflammation will come down and your immune system will get healthier.
So you just mentioned that you focus on the cellular level and cellular repair as opposed to disease. If I understood your presentation correctly, you had something where it kind of showed that it blocks, or prevents, the diet prevents cancer. Do you have any patients that they were able to reverse cancer?
Yeah, so I'm very careful about talking about this topic because in the US currently, you can't treat cancer unless you're using FDA approved medicines and surgeries and all of those things. I can speak from personal experience of things that have happened. So I have definitely had a lot of clients who have cancer who have had really good things happen to them. So I had members of my rapid recovery group whose PSA took a nosedive after being only elevated for prostate cancer. I've had markers for breast cancer and ovarian cancer that went back down to normal range. I've had folks, had one woman with end-stage breast cancer who had tumors that were sticking out from under her clavicle that receded. But I always say nutrition should be in addition to your cancer treatment because it's not the treatment. But it's something that you can do, something you can use to optimize your body's ability to fight back.
Thank you very much for that, Doctor. Our next question is coming from Deborah. Deborah, please state where you're from and ask your question.
Hi, yeah, I just unmuted, sorry. It's Debbie, and I'm from Massachusetts.
Hi, Debbie.
And my question is surrounding the raw vegetables that you suggest, and especially the broccoli, kale, cauliflower, for someone who has thyroid issues, because they're constantly saying you have to cook them or steam them or do something. And I don't have an autoimmune disease, but I'm trying to embrace this lifestyle so I don't get anything. But I already had thyroid issues coming in, and I have not been brave to try to get off the thyroid medicine yet, but I've been thinking more about it. But I know it's a bit of a process because I've been on for like over 10 years. So I don't know if you've treated people and that eating those raw vegetables didn't really affect their thyroid in the medicine they were on, or just what are your thoughts on that? Because it's a bit contradictory.
I won't tell you thoughts. I'll tell you results. Okay. So first of all, Debbie, do you have Hashimoto's?
No, I have just a slightly underactive. So
It's
I'm
just
not
low, but it's not Hashimoto's.
No.
Okay. Yeah. And you saw when I was talking about Julie, how her thyroid came back to normal, right? She was eating all the cruciferous vegetables. I've helped people reverse Hashimoto's and Graves' disease, which are both thyroid issues, with the exact protocol. So the issue is, and unfortunately, there's just so much bad advice out there that's based off of theory rather than based off advice. Where the controversy came from is that cruciferous vegetables are known to mildly interfere with iodine absorption. Iodine is what's used to create thyroid hormone. So the fear is that if you have too much cruciferous vegetables, maybe you won't absorb enough iodine, and then you won't have the thyroid hormone you need. But the problem is now you're malnourished and now you're sicker. So I've had people use my full protocol, full cruciferous vegetables, and reverse their autoimmune diseases, including thyroid diseases, and have thyroid function come back up again. And they were just fine. If you want to make sure that your iodine absorption is where it needs to be, then just make sure you take your iodine separate from your cruciferous veggies. So everybody who does not have thyroid disease should be getting about 150 micrograms a day. If you have low thyroid, you should be getting about 300 micrograms of iodine a day. And that's for your thyroid and for your brain function. So you can always have a supplement or something that you take separate from your meals, and then you don't even have to worry about it. But it's still, you need it for the health benefits. And we have had great results doing that.
Thank you, Doctor.
One other thing for Debbie, don't just stop thyroid hormone. Okay. Your body needs thyroid hormone for all the different organ functions. And it always scares me when people just stop that. If you don't need it anymore, that's great. So if your thyroid function comes back up and you don't need it anymore, then that's awesome. But if you do need it, then it's important.
Great. Thank you so much. So besides inadequacies in diet, what are other causes for autoimmune diseases?
So it's complex. You know, people like to think of disease like a light switch. And oftentimes, you know, I spend 75 minutes in my appointments with people. I really get to know them, and I want to hear everybody's health story. And oftentimes they'll say, like, this day I woke up and I had pain. This day I woke up, I couldn't breathe. And it's really not the case. So, you know, we have our genetics for different diseases, whether it's heart disease, diabetes, autoimmune disease. And then we have to trigger those genes, right? And what I found is it's more like a storm than it is a switch. So, you know, in a storm, you've got the elevation, the precipitation, the temperature, right? All these things factor in to create that specific type of storm. Same with autoimmune. And so what I found to be the different parts of the storm are definitely nutrition or malnutrition or poor nutrition, but also stress, sleep, and emotional trauma. People with emotional trauma and depression and anxiety have much higher rates than the general population in having inflammatory illnesses, including autoimmune diseases. And it's why mood is so much a part of what I teach people. One, it helps people stay motivated, right? If you're depressed or anxious and you're using food to comfort yourself, you're never going to get healthy. But if I can get people happy, they actually heal faster as well, because the moods themselves create inflammation, the negative moods.
Great. Thank you so much. Our next question is coming from Bin Wu. Bin Wu, please state where you're from and ask your question.
Yeah, hello. Thank you. You give a great talk. My question is, And do you suggest your patient to eat the almond or other nuts besides the flaxseed or the chia seed? Any other nuts?
Yeah. So thanks for the question. When you are healthy, nuts are perfectly fine. I use things like cashews and almonds for my dressings and sauces and things. They have a lot of nutrition in them, especially when they're raw. If somebody's very sick and they're trying to heal as quickly as possible, reverse that disease and get their inflammation down, then during that time period where we're rapidly trying to reverse disease, I don't recommend the other nuts or seeds, just because their ratio of omega-6 to omega-3 is still very skewed in the 6 direction. Now, remember, I said that a healthy ratio could be 9-1, and most nuts and seeds are within that safety range. But if your 6 is up to here and your 3 is down here, then adding nuts and seeds really is not helping you do this, which is what we're trying to do. So if you are, really trying to reverse the process, get healthy as quickly as possible, then no, stick to the flax and chia, flax oil, things like that, and get yourself healthy first. For a healthy person, they're actually great. They're satisfying. They do not cause things like weight gain, and they have a lot of good nutrition in them.
Thank you, doctor. What do you eat for lunch and for dinner?
Okay.
And breakfast, and for breakfast, that matter. I guess, what do you eat?
I mean, as a healthy person that's been in disease-free for 18 years. Okay. So maintenance is a lot easier than getting healthy. So in general, I eat a high raw diet. I have found the energy and recovery and disease resistance are just superior, and I love it. I love how it feels. So for me, I usually do raw until dinner most days. So while I'm working, I'm just slurping down my smoothies and drinking my water and feeling good on that. If I have a break, I might grab some Ezekiel bread, which is like a sprouted bread, and throw some avocado on it or something. But for the most part, I have my smoothies during the day. And then at dinner time, I have a huge salad as my main course. And this is my whole family, my kids, my husband. We have a huge salad as our main course. And then we'll have a side of something cooked. So usually it's easy, like something in the Instapot, like soup or quinoa or beans or something. But that's kind of the taste and comfort, but it's not the star of the show, as it were. Now, being healthy, you can tolerate inflammation here and there. So I know a lot of folks will come on and teach and say, like, never can you have anything inflammatory ever again. And then they're secretly eating Impossible Burgers and hoping, no one finds out, kind of thing. Like, you don't have to do that. If you are healthy, you can occasionally, I'm not saying the teachers secretly do it, I'm saying the students, but you can occasionally have something inflammatory if you're healthy, which I do. I got to say, when I was visiting my family, that side of the family has not gone all in on what I teach, like the other side has. And so the whole time I was there, it was like bagels with almond cream cheese and like Chinese food, tofu and broccoli. So it was oils and dry. I just couldn't wait to have my smoothie when I got home, like, nourish me. But I'm not worried. I'm not going to get lupus because I spent a couple days eating vegan junk. You know what I mean? Because my body is nourished. I have been disease-free for 18 years from everything. Like, I don't get colds. I don't get sick. So if you are healthy, you can tolerate a bit junk here and there. Just don't make it the star of the show. On the daily basis, you eat for yourselves. And I taught my kids that you feed yourselves first. So they've been drinking smoothies since they were in their bottles. So that's our breakfast always. And usually it's my lunch. Their lunch is like Ezekiel bread and avocados and like 6-7 fruits, whatever they can fit into their bag to go to school. And then again, dinner is big salad and something. And then on the weekend, we might have one day that we might go to a restaurant and eat what I call it recreational eating, because it's to get high, right? Like a recreational drug, it's not good for you. It's got oil, whatever. But if you're healthy, you can tolerate that sometimes. So.
Thank you very much for that. Okay, our next question is coming from Judy. Judy, please state where you're from and ask your question.
Hi, I'm from Pennsylvania. Thanks, Dr. Goldner. I am underweight, plant-based, and I have a history of Raynaud's in my hands and thyroid nodules. My thyroid tests are normal, but I don't do well on just morning smoothies, like just liquid, because GI issues and things like that. So I feel like I do need a little bit more substance and being underweight. So I was just wondering, what are your thoughts on, do you consider Raynaud's, primary Raynaud's, autoimmune, and what are your thoughts on just like things like oatmeal for breakfast?
Okay. Well, first I have to know, where in Pennsylvania are you from?
Philadelphia.
Philadelphia. Oh, I went to Temple Medical School.
Oh, great.
Yeah. So know the area very well. Went to Central Bucks High School in Doylestown, Pennsylvania, which is north of the city. Anyway, so done really well with things like reversing Raynaud's. Tell me, Judy, what's your height and weight? Can I know so I can see what you mean by?
Yeah, I'm about 108. Sorry. I'm about 108, 5'4".
Okay. I think you're doing okay, actually. Okay. So
Because I have
this issue
osteoporosis too. I have osteoporosis too, so I didn't want to, go too low.
Yeah, I'm saying that I disagree with a lot of what people call underweight. I don't know if you can tell from looking at my video, I'm a skinny person. And what I have found in my work is that people who get healthy rapidly also tend to have low body fat. That it's a thing. So I think that our culture has made people blind to what healthy even looks like anymore. We've mutated what we think healthy is supposed to be, and people want to have curves and all that stuff. And I find it's not necessarily healthy. So I think the focus on weight, it used to be, 10 years ago, everybody just wanted to be skinny. That was the focus. Now, in the past couple of years, my husband and I are seeing people who are afraid of being skinny, and instead they want to be bigger. And that I can't help people with. You're not going to, getting fatter doesn't happen on my protocol. Even if you eat 10 avocados a day, it doesn't make you fatter. So my focus is on health. If you've got Raynaud's, if you are sick, then you need to get the inflammation down. So oats for breakfast, that's not going to do it. That's a weight gain food, yes, but it's not going to give you health. So if your goal is to get healthy, then you need to get the hypernourishment in. If you want to just add hypernourishment, then have your oatmeal first and then have it and then see how you do. And if you get better, you don't need to change anything else. But if you need to get more aggressive, you might have to add more of these hypernourishing foods and have less of the other ones, especially during the healing process. You don't have to do smoothies though. You can eat it. I mean, when I did this, I didn't know about smoothies back when I got healthy all those years ago. So I ate a couple pounds of broccoli and cauliflower a day, just dipping in guacamole all day. I mean, I had jaws of steel, but I just got it done. I'm a get it done kind of person. If you say eat this much or whatever, I just, okay, fine. Like I'll just do whatever it takes. Being chronically ill for so much of my life made me really tough. So if I want to do something, I get it done whatever way possible. So the smoothies are easier and I definitely prefer it. And I don't have to have broccoli in my teeth when I'm giving a talk. But whatever works for you. So if the smoothies don't work for you, then don't do the smoothies. Or some people will make the smoothies really thick. So it's like and then less water, more chia or whatever. And then they spoon it. Okay. Right. Or eat the food, put it into a salad, dip broccoli and guacamole. There's so many different ways. So what you want to get focused on is how do I get it in rather than why you won't be able to. And there's usually a solution. If people are really struggling with their gut, usually that's when an appointment is better with me. So I can really get to know your health problems, your gut problems, and design a program that will get you to the results you want, considering your different issues. The thing about the gut issues, and they're so prevalent, is that the gut issues are a result of your previous diet, and oftentimes they prevent you from embracing the diet you need to heal. So I do help people who have a lot of gut issues focus on that. And gut health gets better quickly too. I've helped so many people reverse ulcerative colitis, Crohn's disease, very, very quickly, often in a month's time, using my most aggressive nutrition protocols. And even people with, irritable bowel who are told they need low FODMAP, nope, we're doing all raw and we're giving them all the fiber and they get better. It's just that sometimes, depending on the gut issue, we might have to go slower or, even use supplements sometimes, which I don't typically use unless there's a gut issue, to help the gut take in the food you need to heal. But that might, again, without knowing you well, it's hard for me to say how you would need to do that.
Thank you for that answer, Doctor. Another question, I was just talking to Brian Clement, who believes that fruit, and he basically practices this at Hippocrates. He believes that fruit can be detrimental to our health with various ailments. What are your thoughts on the health of fruit, whether or not it should be avoided? He believes that it could feed yeast, mold, cancer, that type of thing.
I know Brian Clement, and Hippocrates Institute is cool because it used to be next door to where my mom used to live in West Palm Beach, and they have a raw buffet that if you pay $20, you can eat at their buffet where they serve their patients. So I've actually gone there because where do you get a raw vegan buffet? So so I know he's helping a lot of people there. I talked to people there at his place. What I found, I do not think that there is some harmful effect to fruit. If you're a healthy person and you want to eat fruit, it's fine. What I have found, though, is that fruit-based diets don't create the rapid disease reversal that I'm able to do with the vegetable-based diet. So on my protocol, fruit is not required. It's the vegetables that are required. People can eat some fruit, but we keep it to like 25%. And again, this is on the aggressive, like in my rapid recovery programs, where we are trying to hyper-nourish you to get the fastest healing possible. So there's no room for the fruit. Like we got to get the veggies in there. We got to get the omega-3s in there. We got to get the water in there. So it works without any fruit at all, actually the fastest. And it still works with a little bit of fruit. But once people get their fruit up higher, the results kind of stall out. Why that is, I won't say, because then we venture into the world of theory. I live the world of results. So is it because of some other issue like he mentioned? You would have to test it to find out. For me, I'm just getting people better every day as fast as possible. So what I found is once people, if they're in my rapid programs, then having too much fruit can slow down the process. But general health, I have not seen fruit be a problem at all for people who are healthy. Like I said, my kids eat enormous amounts of fruit. I don't personally, just because I don't like it. I'm one of those weirdos that doesn't like sweet things. So I would rather eat broccoli than eat an apple. Weird, I know. But in general, I have not seen it be a problem. And think of it this way, if people would eat just fruit instead of chips, and where you are in the world and pretzels and all those things, there wouldn't be so many health problems. So fruits are, they've got vitamins, they've got some hydration in them, small amounts of sugar, but consumed with the fiber seems to be fine for people for general health. But when you compare them to things like vegetables, they don't have the minerals, they don't have the high level of vitamins. So for me, in terms of cellular repair, the vegetables are definitely first place.